Welcome back to the MRCEM SBA Success Series. Today we are talking about a scenario that every single doctor dreads. You are in the exam, the clock is ticking, you read a question, and your mind goes blank. You simply do not know the answer. First off, don't panic. It happens to everyone. But here is the difference between a pass and a fail. The average candidate guesses blindly and moves on. The successful candidate uses tactical elimination. In this video, I am going to teach you how to hack the SBA format. I will show you how to use logic, language patterns, and grouping to narrow 5 options down to 2, drastically improving your odds of getting the mark. We are going to look at 3 high standard SBA questions to show you exactly how this works. Let's dive in. Strategy 1, the grouping technique. Our first strategy is called grouping. Examiners often construct the 5 options by choosing 3 from one category, 1 from another, and 1 correct answer. If you can identify the category the question is asking for, you can slash the odds immediately. Let's look at this example regarding abdominal pain. A 76-year-old woman presents with sudden onset severe diffuse abdominal pain. She has a past medical history of atrial fibrillation and hypertension. Her abdomen is soft on palpation with no guarding, but she appears in significant distress. Lactate is 4.2 millimole per liter. The question is, what is the most likely diagnosis? Option A, perforated peptic ulcer. Option B, acute mesenteric ischemia. Option C, ruptured abdominal aortic aneurysm. Option D, acute pancreatitis. And option E, diverticulitis. Okay, let's say you're blanking on the specific symptoms. Let's look at the options logically. We can group these answers. Option A, perforation, C, rupture, and usually E, diverticulitis with peritonitis are conditions that typically present with peritonism, a rigid, guarded abdomen. But look at the stem. Her abdomen is soft. So immediately we can likely eliminate A, C, and E because the physical exam contradicts the pathology. We have just eliminated 3 options without even thinking about the diagnosis yet. Now we are left with option B, mesenteric ischemia, and option D, pancreatitis. Both can cause pain with a soft abdomen. But look at the clues: atrial fibrillation, a risk for clots, and severe pain, pain out of proportion to exam. Statistically, B is much stronger fit. By grouping the peritonitic versus non-peritonitic causes, we found the answer. Strategy 2, the extreme language trap. Strategy number 2 is about language. Medicine is rarely black and white. It's a world of gray areas, caveats, and clinical judgment. Therefore, SB options that use extreme language or absolutes are usually wrong. Watch out for these words: always, never, must, exclusively. Let's test this with an ethics and law question. These are notorious for being wordy and confusing. A 25-year-old male is brought in by police after being found running into traffic. He is agitated, shouting about government spies, and has a laceration on his arm that is bleeding heavily. He refuses treatment and attempts to leave. He lacks capacity due to an acute behavioral disturbance. The question is, what is the most appropriate legal basis for treating his arm wound? Option A, he must be detained under the Mental Health Act before any physical treatment can occur. Option B, treatment can never be provided against a patient's will if they are conscious. Option C, treatment should be provided under common law or Mental Capacity Act as it is in his best interest. Option D, the police must exclusively authorize the treatment as he is under arrest. Option E, you must always obtain next of kin consent before treating a patient lacking capacity. This looks complex, but let's hunt for the absolutes and eliminate them. Look at B. Treatment can never be provided. In emergency medicine, that's false. Eliminate. Look at D. Police must exclusively authorize. Doctors make medical decisions, not police. Eliminate. Look at E. You must always up to next of kin. In an emergency with a bleeding arm? No, we don't wait for phone calls. Eliminate. Now we are down to A and C. Option A says you must use Mental Health Act before physical treatment. The Mental Health Act is for mental health, not necessarily bleeding arms, and it takes time. Option C relies on best interest and common law. This is the language of emergency medicine. Acting reasonably in an emergency is the nuanced, safe answer. See that? We didn't need to quote the section numbers of the Mental Health Act. We just eliminated the answers that were too rigid to be true. Strategy 3. Sequencing. The right thing, wrong time. This is the hardest type of SBA. You will look at the options and think, wait, 3 of these are correct treatments. The key here is sequencing. The examiners isn't asking what helps this patient. They are asking what helps this patient right now. You can eliminate options that are correct treatments but incorrect priorities. Let's test this with a clinical scenario. A 5-year-old child is brought with status epilepticus. He has been seizing for 15 minutes. Paramedics have established IV access and gave 1 dose of IV lorazepam 5 minutes ago. The child is still seizing, airway is patent, and high flow oxygen is on. The question is, what is the most appropriate next step? Option A, administer rectal diazepam. Option B, administer a second dose of IV lorazepam. Option C, perform rapid sequence induction RSI. Option D, administer IV phenytoin. And option E, administer buccal midazolam. This is a classic algorithm question. Let's eliminate based on sequencing. Eliminate the backward step. Options A, rectal, and E, buccal are first-line treatments when you don't have IV access. We have IV access. Going back to rectal and oral routes is a step backward. Eliminate them. Eliminate the too aggressive step. Option C, RSI, is the final step if drugs fail. We aren't there yet. Eliminate. Now we are down to option B, more benzos, or option D, phenytoin. This is the final 2 dilemma. Ask yourself, has the first line been fully utilized? The APLS guidelines typically suggest 2 doses of benzodiazepines before moving to the second line agent, phenytoin or levetiracetam. Since he has only had 1 dose, jumping to phenytoin is jumping the gun. The correct next step is the second dose of lorazepam. So to recap, when you hit a wall, the step 1, group the options. Are 3 surgicals and 2 medical? Are 3 stable and 2 unstable? Eliminate the groups that don't fit the clinical picture. Step 2, cut the absolute. Always, never, and exclusively are usually traps. Step 3, check the sequence. Eliminate answers that are right treatment, wrong time. Either a step backward or a jump too far forward. If you use these techniques, you aren't guessing anymore, you are deducing, and that is how you pass the MRCEM SBA exam. In the next video, we are going to tackle one of the most high-yield practical topics, ECG to action, nailing the management SBAs. I will see you there. Please don't forget to like and subscribe. Goodbye.